Amit, thanks so much for joining me today as we talk to leaders of Woodruff Health Sciences as well as Emory Healthcare. Your department touches almost every single patient that walks through our doors, every single patient that's an inpatient as well as outpatient. There's probably no patient in our system that doesn't go through one of your procedures, one of your rooms, one of your imaging techniques. That's a pretty profound responsibility.
Oh, absolutely.
So that said, it's so critical. Let's talk about radiology, but before we do that, let's talk about yourself. How long have you been at Emory, and what's your journey to becoming a chair?
Yeah, and thanks so much for the invitation, Ravi. I've been at Emory now for 16 years. My journey is one that started in India. I was born there, and many people don't know this about me, but my roots at Emory go very deep. My dad was a postdoc in Dr. Dennis Leota's lab in the Department of Chemistry.
Wow.
When we arrived from India. And so I went to school just down the road at Fernbank Elementary. Moved around a few times, grew up in upstate New York, and then went to Hopkins for college, Penn for med school. And then I followed my mentor, someone by the name of Bob Grossman, over to NYU to do diagnostic radiology and neuroradiology. And in 2008, came down here as my first real job at Emory, and have been here ever since.
You have a large department. I know you're very proud of the faculty and staff. Where exactly in the system are your faculty and staff?
Yeah, so we have 220 faculty and over 1,000 staff scattered throughout the system. And we are covering 10 hospitals and 10 imaging centers across Emory Healthcare, as well as our affiliates within Atlanta.
Wow. Radiology is an evolving field, not unlike other areas of medicine. You've been in your job now 2 or 3 years. Where are we 5 years from now, 10 years from now? Is it going to be different hardware, different software, different ways of reading, AI? What's sort of the bouquet of changes that you anticipate?
Yeah, it's a really exciting time to be in radiology right now. There is so much new technology on the horizon. There's so much promise of artificial intelligence. Our relationship with Emory Digital and the way that we can enhance our workflows and technology and take advantage of AI, all of those are actively being worked on, and it's a really exciting time from that standpoint. There's a lot of efforts going into things like ultra-low field MRI, something you could, ultimately see being put into a CVS and getting,
Really?
something done, and using AI to help sort of screen people for, is this someone who is kind of doing okay, or is this someone who needs to get a better quality scan or get a further workup? So
Wow.
I think we're going to see much more imaging and sort of a different paradigm than the kind of getting a yearly scan.
I just can't imagine going to CVS, picking up a medicine, buying toothpaste, and getting an MRI.
There'd be so much great information that comes from that, and it begs the question, how do we handle all that information, all that data that's coming in?
Yeah. There's certainly a lot of press about how AI can actually detect things much earlier than humans can see, let's say, changes on a mammogram and so forth. And so my guess is, on the one hand, it's threatening, right, to a profession, but on the other hand, it actually expands your repertoire of things you can actually do, early stage, late stage, general diagnosis versus very specific reads that have to take place, and perhaps only humans can do them.
Yeah, I think the field of radiology in general has gotten past the point of being threatened, and we realize that there is a lot of room for improvement, a lot of areas where AI can augment what we do, help sort of pull together information and make those kind of predictions for the benefit of patient care.
I mean, your department is also one of the most prolific in terms of publications as well as grants at the institution, and maybe touch on that for just a minute.
Yeah, we have a few really core strengths in the department and some very active investigators. I think we've been able to leverage a lot of this technology, a lot of talent that we've both homegrown and brought in from the outside. to produce really a fantastic research enterprise that complements everything else that we do.
Yeah, the research, the clinical, the teaching. I know there's outstanding
Yes.
teaching in your department as well. So
Yeah, we have actually one of the biggest residency programs in the country, and we've won the Best Training Program of the Year award the last, or 2 out of the last 4 years.
wow,
So
congratulations.
thank you. It is our one of our pipelines for talent in such a challenging market for bringing on radiologists, and so we have been working on ways that we can build those pipelines, accelerate people's paths into various subspecialties, and not only meet the workforce needs for our clinical radiologists, but bring on our next generation of scientists and educators.
Yeah, fantastic. Well, we couldn't be happier about you being the chair. I know you've had a lot of work over the last few years to change the way we operate, just as you highlighted. You've brought ideas to actual reality, helping the patients, making it an incredible environment for our faculty, our staff, our students, our trainees, and could not be more thrilled about you being the chair of the department. So thank you for your time.
Thank you so much, Ravi.
Great.